Good afternoon. Thanks for joining us here. I'm Robert Hadlock.
And I'm Sydney Benter. Austin Public Health says the first COVID-19 vaccines should arrive here next week. The department's interim director is also clarifying what guidance he gave Austin's mayor prior to attending a wedding and then traveling to Mexico.
KXAN's Tom Miller spoke with Dr. Mark Escott during today's media briefing.
The initial 13,650 Pfizer vaccines are expected to arrive at local hospitals and healthcare providers next week. The goal here is to stabilize healthcare infrastructure, meaning keeping the people who take care of us when we're sick healthy. They estimate that initial shipment we'll receive will be enough to vaccinate about 50% of all hospital staff in our area, with priority going toward people working in the COVID-19 wards, then ICUs, then emergency rooms. There will be many other vulnerable people in our community who aren't getting it right away, including an estimated 195,000 people 65 and older. As for the fallout surrounding the mayor's trip last month to Mexico, I asked Interim Health Authority Dr. Mark Escott what exactly he told the mayor about traveling, and he says that never came up.
So again, we didn't have specific discussions regarding trips, but I'll say that generally speaking, our guidance at that time at stage 3 of risk did not include in avoiding travel. For those individuals who were in the lower risk category.
Escott went on to say if the mayor had asked, he would have said traveling was okay at the time, but noted the situation has worsened considerably since then. As for the holidays, APH leaders say they are now seeing a surge in cases linked to people who gathered during Thanksgiving. As a result, they are pleading with people not to get together over Christmas. Back to you.
Tom, thank you. We want to give you a quick look here of Austin Public Health's new quarantine recommendations they revealed just yesterday. Walking you through the flow chart, the first question is the most important one perhaps. Have you been in close contact with someone who has COVID-19? If so, APH wants you to consider whether or not the exposure occurred when face masks were not worn. If the answer to that question is yes, Austin Public Health recommends a standard 14-day-long quarantine. If the exposure occurred while masks were being worn, but you live or work with people who are at high risk or of severe disease from COVID-19, it's 14 days for you. If you don't live or work with a high-risk person and you're not a healthcare worker or a first responder, the recommendation is to either undergo a 10-day-long monitored quarantine or a 7-day quarantine with a negative COVID test. That second option is also the recommendation if you are a healthcare worker or first responder. A 7-day quarantine with a negative test on or after the 7th day. If you